Okay, okay. I think we're good. I think more people are joining, so we'll be starting just now, maybe in a few minutes,
Are
as
we
more
live
people are
right now?
joining. Yes, we are. Yes, we are. And welcome to everyone who has already joined. Um, Thank you to everyone who's already joined. I think we'll be starting now. My colleague Jessica, Sarah Bridge, was supposed to be hosting this webinar with me, has had a death in the family, sending out our love to her, and Sarah Idel will be joining us, and will be in the other Sarah's place. But I would like to acknowledge the work that she put in the preparation for this webinar and our our love. We're sending our love to her, and our hearts are with her in this time. I will hand over to Sarah just to welcome people and just to give out a few housekeeping issues and introduce our panelists today.
Thank you, Mercy. Welcome, everyone. Yes, I didn't know I was going to be co-hosting until last night, so forgive me if I'm a little, I'll do my best. We're so glad you're all here. Housekeeping, we're gonna, other than the panelists, everyone will have their camera turned off for confidentiality. Please put your questions in the Q&A and we'll read them through towards the end or at intervals. And we will have a recording that will be available after the event. We live and work upon the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas. This land is covered by the Dish with One Spoon Wampum Belt Covenant, which was an agreement between the Haudenosaunee and Anishinaabe to share and care for the resources around the Great Lakes. This land is also covered by the Between the Lakes Purchase, 1792, between the Crown and Mississaugas of the Credit First Nation. We also recognize the contributions that Métis, Inuit, and other Indigenous peoples have made in shaping and strengthening our communities, provinces, and country as a whole. We are grateful for the opportunity to work in this community among so many Indigenous people from across Turtle Island. We thank all the generations of people who, for thousands of years, have taken care of this land and each other. We recognize that to do our work well, we must integrate more Indigenous ways of knowing into our model of care. Um, I'm gonna talk through the three entities that came together to bring this panel to today. Why and Positive Living Niagara and Positive Health Network. And then what we're going to do is I'm going to turn it back over to Mercy, and she's going to kind of do a foundational um, presentation on gender-based violence and HIV. And then we dive into the fun part with our panelists. So it'll be a lot of information, but hopefully we'll keep it hopping. So what is WHY? For those of you who may not know what WHY is, this is a grab from their website. It's community-based response to HIV and AIDS among cis and trans women, two-spirit and non-binary people across Ontario. Um, their work is rooted in community development and collective impact. They have over 17 Y coordinators across the province, and Mercy is one. She works for Positive Health Network, and the Sarah Birch, who is unable to be here, works for another or one, which is Positive Living Niagara. And that's what's really neat. It keeps all the coordinators working in this area align together across the province, and it keeps the information flowing from the community back to Y to the ministry, back to Y to the community, and it's a really nice approach. So WISE goals are, as you'll see, to reduce HIV risk for women disproportionately affected by HIV, enhance local community capacity, and build safe environments to support women's HIV-related needs. Now we're looking at the two other organizations. This is the one that Mercy and I belong to, Positive Health Network, and our executive director, Tim McClement. We serve people who are living with or at risk of HIV in our communities. And our sister organization is Positive Living Niagara, and they work in a likewise manner. Now, we each have different approaches, which is really exciting to learn about and to work together to learn from. So please check us out. Go to our websites and figure out what's different, what's the same, and what we're working on and what's afoot, because lots of great work is underway. So our panelists today, we have four, and I'll tell you a little bit about them. We have Michelle Markowski. Michelle is manager of low barrier and harm reduction services at the YWCA in Hamilton. She has over 10 years of experience supporting marginalized communities across the mental health outreach and homelessness sector. Michelle specializes in trauma-informed low barrier and harm reduction practices, shaping programs that prioritize gender equality, equity, safety, and inclusion for women and gender diverse people. Jessica Benella-Damti, a Latinx Indigenous woman from El Salvador. Jessica has devoted her life to creating safer communities. Jessica is a graduate of McMaster University School of Social Work, Indigenous Studies, and Health Studies programs. Now the ED of the Sexual Assault Center, Hamilton and area, Sasha, she is leading numerous initiatives in Hamilton, all of which aim to build a city free of violence and oppression. Carrie is a two-spirited Indigenous 26-year survivor living with HIV. Carrie has been an advocate and activist in the HIV sector for the past 11 years. She is a retired researcher at McMaster University, where she worked on a global sexual and reproductive health and rights project involving Indigenous women and girls living with HIV. And Caitlin is an Anishinaabe woman with ancestral roots in Sheshagowanang First Nation on Manitoulin Island, but now based in St. Catharines, Ontario. She has been a sex worker for over 12 years. Caitlin brings lived experience, resilience, and compassion into everything she does. We are so lucky to have the four of you today. And yes, at the end of this, we hope you'll stick around for just a quick survey so we can hear what you think, what you liked, and improve our next session. So I believe with this, I'm going to turn it over to Mercy, who's going to dive in on the 16 days of activism. Mercy, we can't hear you. Sorry, just go start again. Yep, you're still
Oh,
muted.
I'm sorry about that. I guess I'm nervous. Um, I would like to say thank you so much for the introduction. That was very well detailed. And I would like to welcome our panelists once again. And as we commemorate the 16 days of activism, we're just looking from awareness to action. Now we want to reclaim safe spaces for all women and gender diverse people through education, prevention, care, and community engagement. So for a lot of these things that I'm going to talk about, I'm just going to give an overview because I want to believe we're going to delve deeper into this with our panelists. So just to give a context of what we're looking at, we want to focus on reclaiming safer spaces for women and gender diverse people. So um, just to give an overview of gender-based violence, what it is, and where it's rooted. When we talk about gender-based violence, we're talking about violence that directed to people because of their gender, and it's rooted in gender inequality and power imbalances. It can be physical, emotional, sexual, or even economic. And as we all know, it disproportionately affects women and gender diverse people who are accessing services as well. As I've already alluded to, it disproportionately affects marginalized women and gender diverse people. And we have a whole lot of social determinants that shape the vulnerability of this group. And we also have structural barriers that influence the prevention of care for women and gender diverse people. And you will see that gender-based violence and like the nexus between gender-based violence and HIV, it's actually a very dangerous cycle where GBV increases HIV risk, and also on the other hand, HIV status can actually trigger new or escalated violence against women and gender diverse people. Um, Looking at the impact of GBV and HIV, you'll notice that it affects very marginalized groups. We call the key populations. And we're looking at people who are living with HIV, women and gender diverse people, newcomers and migrants, communities of the two-spirited and LGBTIQ communities, sex workers, and people who use drugs. I want to believe that as we have these discussions, we're going to have to hear more from our panelists as well. And looking at the determinants that are driving these intersectionalities, there's poverty and housing insecurity. We've got legal precarity, especially when somebody is an immigrant and they're scared to go to the police because they think that it will affect their immigration process. We have stigma and discrimination, mental health and trauma, limited access to women-centered care, which we also want to really delve deeper into with the panelists here. And our proposal that we need to have more education, prevention, and care engagement with with our communities for us to be able to create safer spaces for women and gender diverse people. Um, and today we are featuring women who have been doing the work and who have lived experiences in GBV and HIV. And we also tried as much as we can to ensure meaningful representation. And we are just here to listen to and learn from the women who are here as part of the panel to um, find a way for us to create safer spaces for women and gender diverse people. And all these strategies that we have, trauma-informed practice, harm reduction, strengthening cross-sector partnerships, and culturally inclusive approaches, we are also going to talk about all these, and we hear more from the people doing the work and people with lived experiences on what we can do as communities to create these safe spaces for women and gender diverse people. And these are just recommendations for service providers who are here joining us. We want to build integrated responses to GBV and HIV. We also want to promote safety, confidentiality, and choice, and include the peers and the peer leadership and community voices, and also be able to use the data that we collect to inform the programming that we provide to the communities. And just to conclude, we also want to recommit to advancing women-centered services and move from just awareness to actionable steps. Thank you very much. And I think we will just delve into the conversation with our panelists. And I'm just going to ask all our panelists, we can just do a round. Um, you can just start by letting us know what pushed you to be part of this panel. And also, you can share as much as you can or as little as you're comfortable sharing about your connections to the topic of GBV and HIV. I will start with Jessica.
Hi there. Good morning, everyone. Buenos dias. I'm Jessica Buenia Dante. So I'm really thankful to be here today and happy to be sharing space with all of you and my co-panelists and our hosts. What brought me to this discussion today is my organization, the Sexual Assault Center of Hamilton area, also known as SASHA's, commitment to supporting survivors and addressing the systems that make women and gender diverse people vulnerable to both gender-based violence and HIV. So I'm not an expert on HIV in any way, and I rely on our incredible community partners at the Positive Health Network, whose knowledge and leadership guide our work and deepen our understanding for sure in Hamilton and surrounding areas. So I want to thank them for today's event and for allowing Sasha to participate. At Sasha, we see every day how stigma, inequality, and violence shape people's access to safety, to health, and to care. So I'm here because bringing these conversations together strengthens our collective ability to create safer and more inclusive communities, and out of a commitment to community care that works towards ensuring every person can access support with dignity, compassion, and without fear. Thank you.
Thank you very much, Jessica. Thank you for that. I'll allow Caitlin to take the space.
Hi. So I'm here today just representing, I guess, the viewpoint from somebody that's actively doing sex work. Um, in the sex work community, there still is a whole lot of stigma and a lot of violence that does happen, and it does sometimes impact access to services. There's a lot of conversations about public health and violence prevention with sex workers or people being trafficked. Um, but a lot of the times people actively engaging are sometimes missing from the table. So for me, today showing up is just trying to claim space for sex workers, and just recognizing how the criminalization and stigma and unsafe systems impact everything and how gender-based violence kind of plays into that.
Thank you very much, Caitlin, for that. And I will call on Michelle. My apologies, Michelle. It's Michelle with one L. I think that's how it generated in the system because that's how I entered, and I'm really sorry about that. Um, I'll
No, it's
invite you to
okay.
take this phase.
I think it's important for us to practice taking up more space. So I'll use that metaphor for taking up space in my room as a racialized woman. Uh, my name is Michelle Marquesque, she, her pronouns. I work at the YWCA Hamilton, and I'm the manager of harm reduction and low barrier services, as you mentioned. So I think what brought me to this conversation is the connections that we have to community and the importance in our space of improving safety and dignity and access for folks that experience really high levels of violence, being one of the lowest barrier spaces in the city of Hamilton. As somebody that is born and raised in Hamilton and really has a lot of connection and passion for the Hamilton community, one of my first placements when I was in school was at the Positive Health Network, and that was my first introduction to harm reduction and to meeting with the community and providing access and dignity to support to supplies and support and care. So I think coming to this conversation to just kind of like highlight the importance of committing to harm reduction and trauma-informed care when we're doing this work. Um, and kind of seeing how that impacts people's lives when they're navigating housing and homelessness and violence and the increased risk of HIV to people that are disproportionately experiencing violence in our community. So that's kind of what's brought me to this conversation.
Thank you very much. We're happy to see the collaboration between the different agencies in our communities, and that really works because you can't work in silos. What we can't give, the next organization will be able to also chip in and do that. I think one of our panelists, Carrie, is having trouble joining. Hopefully, she'll be able to join us before we come to the end of our discussion. I think my first question would be, why do you feel it's important to talk about HIV in the context of GBV? And while we are addressing that question, we could also talk about the barriers to services that women and gender diverse people who are living with HIV or are at risk of conducting HIV. What are the barriers that they face? in their journey of accessing services? I'll start with you, Michelle.
Well, I think, as it was mentioned by Caitlin, there's the stigma that folks face. I think on top of the stigma and the violence that they're experiencing in the community, that affects their access to testing, to treatment, to consistent care. So it's really important to create spaces where people feel like they can, really talk and be supported and even make some of those disclosures. We know that gender-based violence limits people's ability to negotiate safer sex, at times, and harm reduction practices. So there's at times the fear of kind of experiencing further violence as a result of maybe their status or not being able to access, testing for their status.
Before I probe any further, maybe I'll give Caitlin the platform, but I'll come back with another question for you as well.
I feel like they kind of go hand in hand. Specifically, I feel like as a sex worker, HIV risk isn't necessarily just like an individual choice, right? Because of the gender-based violence and the risk, like they are the same, right? Because we don't always, and we should have the right to say, hell no, I'm not doing that. But the reality is you don't always have that right. When you're in a world of obviously the insane costs that we have now as well, right? That is playing into things. Um, from what I'm hearing in the community now, you're having a lot more like unsafe, I don't even want to say unsafe, but kind of riskier practices are happening now just due to that. And that's all shaped by power, criminalization, violence. It all kind of goes hand in hand. And then the criminalization also kind of pushes everything into the shadows a little bit more, just based off of the law system that we're working with right now. It makes it a little bit trickier to negotiate those safer sex acts, right? Like when I came into the industry around 12 years ago, Bill C-36 came in, I want to say 2 years after I came in. And at that point, everything kind of shifted from like a covered blowjob to a bareback blowjob. And that creates inherent risk as well, right? Um, so I think it's important to talk about HIV as well as gender-based violence together because they do very much, um, they kind of go with each other, unfortunately. And even within the systems that, like even within healthcare systems, right? It's really tricky to go get tested every other week or every 3 weeks, right? Like I remember there was a time period where I was having to switch between three different doctors because I was unable to get tested as frequently as I wanted to get tested because that's what made me feel safe. At this point, we've come a really long way, but it's still remembering where we were to where we are, right?
Thank you for sharing that, Caitlin. And what would you say are the barriers to services that are very, like the prominent ones that women do face, women and gender diverse people?
A big one is substance use. Like point blank, doctors are still not great with substance use. I had to pay $4,000 for an ADHD diagnosis because I use substances. It's not drug seeking behavior, it's ADHD. Um, and $4,000, that's a lot of people to sleep with, right? So it's like you have the stigma of, okay, you shouldn't be doing this work to, okay, you shouldn't be using these drugs. Let's focus on my care. Let's focus on that.
Yeah, that's a lot to take in. I'll give Jessica the space.
Thank you. I agree with everything my co-panelists have said. And along with that, the stigma, we know that many survivors, many women, gender diverse individuals, and people living with HIV, they fear judgment or mistreatment when seeking help, as Caitlin has mentioned. So like especially when we're talking about HIV and gender-based violence, so survivors of gender-based violence may already be navigating control, trauma, or isolation. And so when you fear mistreatment or being turned away, you're less likely to go get the support that you need. With that excellent example that Caitlin just provided, like wanting to go to the doctor to get tested, and the doctor, mistreating you or not letting you do that. So that's a real barrier to knowing that you will be mistreated and judged.
Yeah, that's a lot of work that needs to be done by service providers, I believe. And having to fork out $4,000 just for you to be able to get a basic service is out of this world. And not everyone has their hands on $4,000 just for that. And that is very sad. So my next question then would bring us to what service providers would call the ideal safe space for people seeking these services. What would you say is this the the best scenario, or what would call the best space? What would that have? How would you envision that to be a safe space for people seeking these services?
Thank you. You muted, but I can carry us away. Um, I think it's important that we lead with harm reduction practices. And, as services really look at what harm reduction means as a practice, as opposed to just providing supplies, but then still having, harm inducing practices and policies. Um, I think normalizing sexual health and substance use conversations in a way that is non-stigmatizing and not only treatment focused, but looks at the spectrum of where people are at and truly meeting them where they're at in their journey and not needing to push them along in any said journey, but just really sitting with them, being consistent and reliable and following through. Um, really looking at if your services are culturally relevant and have accessible information, right? Are you just sitting there and pretending you're the expert of people's lives? Are you listening to what they have identified as their experience and their expertise and continue to just sit with them? And, no pressure to disclose, I think is really important. When we go into these care professions, I think sometimes we can slip into um, really trying to tell people what they need to be doing, and it's really important that we sit with and respect people's autonomy and go at their pace, because that's the way that we're going to reduce stigma, meet people where they're at, and actually share community and reduce barriers and stigma around sexual health, substance use, mental health concerns. These are all systems that are rooted in the same stigma of colonialism, stigma of poverty, criminalization. So we need to create spaces where people can actually speak about their experiences, hear them, and try to meet their needs one day at a time.
That's true, Michelle. I think does anyone else want to add on to that? Uh, Jessica?
Thank you. No, just like Caitlin's applauding Michelle, that was an excellent answer. Thank you. And it covered, I think, mostly everything, or did cover everything. If I were to add anything, it's as service providers, like Michelle said, not thinking that we're the experts in somebody's lives. We have to recognize that the individuals that we're working with are the experts in these lives. They've gotten themselves to this point and they're surviving to this point. And so we're there to listen, to support and offer resources that are available. And so I think as service providers too, it's important that when we offer resources, we listen to individuals who say, actually, you know what, that resource isn't one for me that I can use. What else is available? And making sure that you are respecting confidentiality and autonomy, and not being frustrated when somebody tells you, I can't use that resource. They know why they can't use that resource or why that resource isn't for them. So that's part of being trauma informed and survivor centered as well, and respecting individuals' autonomy. So being creative in the way that you are able to offer supports and services as well is really important, and not being so rigid, despite I know funding has timelines and whatnot, and we say you can only have so many sessions, but trying to be as flexible as possible in supporting that individual to ensure, even if it's not you can offer the support through your organization, but looking at our community partners and seeing who is a good fit for this individual based on what that individual says for themselves as well.
Thank you very much for that, Jessica. Maybe Caitlin, you could maybe give us an overview of what you would think would be a safe space for people seeking services. Like what you've said, you had to pay $4,000 because a service provider would not take you, what would you say would be a safe space? What would you call a safe space? What would that entail from your perspective?
I think it's a safer space. Safe, like nothing is ever going to be safe, right? Like safety is such a sometimes pie in the sky dream, right? Like it's like that's not even something one can imagine, but safer is something that we can all do, right? And I think as Michelle and Jessica have said so perfectly, like all of that. And just recognizing that people are people and not just risk factors or they're not at risk, right? Like you're more than a risk. And letting people lead the way, right? Like, let me tell you what I need. You hit me back with that, and then let's work through it. Give me all the information I could ever need. Like when you go to a service and you access that service, and like Jessica mentioned, some of them do have timelines. Like sometimes you only get that funding for a year, and be transparent about that, right? Like let people know, okay, this is how long you have this for. If we put this through now, that's what you got. And just like sharing all of the information so that the other person's going in fully aware of everything that they have access to, right? Because why the heck wouldn't you want somebody to get the most of the funding that they have for that, right?
Thank you for that. Sarah, do you have anything to add on that or any follow-up question on that before we move on um, to the next discussion?
Well, lurking in the back of my mind is like PrEP, of course, and access to it. And I'm kind of curious what folks experience on getting that and access to that has been.
Who would want to take that? Any one of our panelists?
I wonder if you could rephrase the question or repeat it, please. I didn't understand.
Sure, sorry about that. So PrEP, the medication that we can take proactively to eliminate the chance of contracting HIV. My understanding is that here in Ontario, one can get it for about 3 months free, but then after that, it becomes super expensive. So I'm wondering how whether that's something that is not accessible enough, or how you all feel about that.
I think it's tough to speak to because, like, as we know where we're starting at, I think at least in my space is really base level basic needs for a lot of folks. So people even getting to a doctor and needing a health card when you're experiencing homelessness, like there's so many barriers before people can even make it to the doctor to ask for PrEP to then. So we're at the stage of trying to get access to free condoms. Like we're I think at least in our space. So we're doing everything to kind of hit both angles because I think that's what we know we need to do as well. We're acknowledging that we need to create lower barrier health care that, is gender specific and acknowledges the barriers and the different sexual health needs of the individuals we support, and trying to come at it from that healthcare angle while meeting basic needs. So I think that the conversation of PrEP for people in my space that are experiencing homelessness or are precariously housed is not one that's far away. It's one that it happens, but I think there's so many barriers before we can even get to that point that I don't have like a full answer to tell you what it looks like when somebody's in a space where they have their ID, they're meeting with their doctor regularly, they know what day it is to even keep track of time, to make that doctor's appointment, to then know that it's been 3 months of having their PrEP without their PrEP being stolen, I'm sure within the first week, if they're, it's in their bag and their bag was taken. So yeah, I don't have a full picture of what it looks like for folks on the ground. I think it's a good thing for me to like really write down and think about and have conversations about. But I think if I had to kind of guess where we're at and our barriers, and it's not as much of a guess. It's kind of like the reality of what people are experiencing when they're experiencing homelessness, at least in my services.
Yeah, that's such a good point and reminder. And it just made me think of how um, we get a clinic here for sex workers, and they're all asking for lube because nobody can get lube anywhere right now because
Oh,
the
yeah.
province isn't putting it out. And that alone, like sex without lube, like that is violence, it can be. So I think I mean, just getting the basics, let alone PrEP, but I hear what you're saying. So thank you.
Maybe
It's been a
that also,
huge.
sorry.
So I was gonna expand on the lube challenge that we're also experiencing. It's something we've been trying to share across programs to see who's got lube left and trying to put it out in spaces that people don't need to like ask for it, but also trying to like keep a hold onto what we do have. It's yeah, not fun to operate in the scarcity space, from like a frontline perspective of service provider.
Yeah, I think like what you have said, Michelle, that at times you can't even have these other conversations because they seem secondary because someone else is already they have these primary needs that you have to take care of before you can start talking about other things that would seem secondary as well. Um, but maybe also because we're talking about people who have not had do you feel that people have enough knowledge of GBV and HIV and the connection between these two and what they need to do, or you believe that we need to do more as the service providers?
I could answer that question if I could follow up on the other question as well.
Thank you.
I think from a service provider lens, so as a sexual assault center who doesn't have a clinic or anything, we are counseling based, community based in terms of doing abuse prevention and outreach. So when survivors come in into a counseling session, perhaps that's when the conversations happen around being able to access PrEP. And so from my perspective, then a counselor would come to me and say, hey, what do we do about this? So I think this is a good example of community partnerships and collaborations when we're able to call our partners in community and say, this is the situation that's happening. What are the resources that are available? Or is it okay to refer this individual to meet with you with their consent, of course, to get more information of what's available and resources? Because like as a sexual assault center, we wouldn't necessarily have this information, or even could be going downstairs to the building where Michelle works and asking our partners there, like, what do you know about this? And in terms of obtaining other items such as lube, we wouldn't know that those are not available to everybody unless we hear directly from the people that we're serving, in which case we would have to see in our budget if there's some magic money available and we can source these items out for our specific service users, or have some available in the office for individuals to take. But moving to the other question, I think it depends on the communities that you're talking to. And so I'm thinking of our Diverse Communities Outreach Program that supports survivors of all genders, 16 and up, and who mainly are newcomers, immigrant, refugee, and or new mothers. And sometimes the connection between gender-based violence and HIV isn't there unless someone's just experiencing it directly, right? Unless someone is at risk of HIV or has HIV. And really because individuals are newcomers, they're facing the challenges of being a newcomer and what that means, right? And maybe not thinking about that as their central focus, right? Because the central focus, as Michelle was explaining in her program, is folks are unhoused, right, and looking for housing. And then as a newcomer as well, you're trying to make sure that you can keep your kids if you're going to be unhoused because you don't want CAS involvement. And or you're looking to maintain your permanent residency status. And if you're in an intimate partner violence situation, perhaps your partner is telling you that if you disclose any of this to anybody, you will lose your status or you will be put in jail. So I think what's necessary is more conversation and opening up the doors to conversations that include various topics, including HIV and gender-based violence. So the way that we would do this, we have a sewing program, and it's meant to break isolation and bring newcomers into community to learn to sew, and then have a conversation and say, as a group, are we okay inviting community resource partners to come in to let us know what supports and services are available in community? And one of those might be the Positive Health Network. And that's where we bring in that conversation. And after the conversations happen, perhaps the participants want to have further conversation, or participants are able to disclose either to the the person, the facilitator or the program coordinator, that they would like more supports in this way. So a long response, but just ways of kind of bridging that gap through programs and services. Thanks.
Thank you very much for that, Jessica. I think as you were talking, I also had this question coming to me. Um, as you know, services like from reports from OHTN and reports from Katie, we've seen that there's low uptake of PrEP and PEP by women and gender diverse people. And you, as an organization that takes care of survivors of abuse, I understand that you probably have people coming to you because they've been sexually abused. And as for sexual abuse, it only somebody has a window of 72 hours for them to get post-exposure prophylaxis, which is PEP, for them to lessen the chances of them contracting HIV. Have you had any problems trying to get people to get PEP for them to lower the risk of getting HIV? People who have come to you having been sexually abused.
So specifically as a sexual assault center, I would say our first interaction with someone who's been recently sexually assaulted would be through our crisis support line, which is 24 hours a day, 7 days a week. And so on our crisis support line, if it's a recent assault, one of our main objectives is to encourage that caller to receive medical attention. And so in receiving that medical attention, giving them the information of which hospitals they're able to go to, where the sexual assault nurse examiner is. So in Hamilton, it's the Juravinski Hospital and or the General Hospital. And in going to that hospital, then being able to receive that medical attention, including those the PrEP. Other than that, I wouldn't say we have experience. Perhaps hearing anecdotally through counseling services of individuals who haven't been able to obtain that, but because of our very long counseling wait list, we wouldn't see individuals who have been recently assaulted in that case.
All right, thank you so much. Thank you for that response. Maybe Caitlin, if you've got anything to add to that, access to PEP and PrEP, how has that been for you and the communities that you serve?
Like Michelle has stated, it's very much like I don't want to say it's a privilege because it shouldn't be, but it is reality, right? Like when you're looking at it. So if you're doing sex work most of the time, and I can only speak for myself, but that would like I had no health benefits. So like, am I gonna take food off my table? No. I wasn't doing that. And knowing what I know now, I have been able to reach out to inquire for it after an assault. Um, but like it's easier to access now, I would say. Like we're getting there, but it's still not at the point where it's like readily available, affordable, um, and something that I would say would be realistic consistently. Just also remembering the fact of like, depending on how you're working, like I was working in hotels, but moving all the time. So if you're moving from room to room to room to room, to have meds that you're taking consistently every day or staying on top of that is really tricky. Um, like like the lifestyle very much was 7 minutes at a time, right? Like it was like 15 minutes between calls, okay, 7 minutes to shower. Like it's again very pie in the sky dream. And I think we're getting closer like in terms of accessibility. I just don't think we're quite there yet. If that's fair to say.
Yes, it is. And maybe my follow-up question to you would be, do you think that women and gender diverse people um, have knowledge of these services or what PrEP is or what PEP is and what that could do for them in the context of GBV and HIV as well?
I think that outreach has come a long way from where it was when I started. But again, like I think like when I'm thinking about like my agency days, I don't think that those conversations were happening. Like it just wasn't really talked about. And I think that there's still a lot of work that can be done there. But again, recognizing that sometimes the sex worker community can be hard to kind of get into, right? Because of the fact that we're also still very separated. Um, like again, different working scenarios are different, right? So, but from where I was coming from, like every person was in a different hotel room. So like it it just wasn't like it wasn't like somebody was coming in and be like, "Oh, I found out about this great thing. You should reach out to this place, this place, this place and try and like get on it, like figure it out kind of thing." It's not like those conversations were happening just because of the nature of how separated we are, right? Um, the sex work community is a big, beautiful thing, but it's also very, like we've all kind of spoken about, it's very siloed, right? Like there's still very much I'm going to call it a hierarchy, right? Like you have these different levels of sex work as well that kind of look at each other differently. So, um, yeah, I hope that answered that.
It did. It did. Thank you very much for that. Sarah, do you have any follow-up questions on that before we move on?
No, thank you.
Okay, maybe you would want to take the next question as well.
Sure. Um, I'm curious about how we demonstrate cultural competence in the HIV and GBV context when working with Indigenous ACB newcomers, sex workers, people who use drugs, trans, like what do we really need to know as service providers that is the nuances and all the intersections? What are some real good pointers that service providers should know when talking with and helping people in this area? And I'm thinking, the cultural competence piece. And I think you talked about some of it, especially around sex workers. But what about other communities?
I think it's important to start with being really intentional. I think being really intentional in the language that you use, really intentional in the spaces that you're using, really intentional in the questions that you're asking, really intentional in the services that you're offering, and kind of looking at ensuring that you're not assuming anything, not assuming anybody's identities, gender, sexuality, behaviors, experiences. So it's being intentional in your questions and really trying to build spaces that people have essentially like asked for, or like in collaboration with people that you're working with. Um, I think at the end of the day, like it needs to be like a priority to maintain dignity and respect and create community spaces. I think Kaylin, you brought something really interesting. We were talking about like not having kind of like a spot that people can go to kind of like talk about that. I know through our recent work with the after Elizabeth Fry, the YWCA took on the justice services work, and we're still starting out, and it's really really big shoes to fill. But something that we're really trying to get off the ground is our sex worker drop-in. Whether we call it that or we call it something else, so it's a bit more discreet. Like that's something that is really important to the work we're doing for that exact reason. Like, how can we create, and that's why it's also been challenging to get off the ground because we're trying to like recreate it based on the need of the people that are coming at the time and who's accessing and who's around. But really trying to meet the needs of people so that we can then create that hub in that space where it's still also a low barrier drop-in space, but then you have kind of like the opportunity to talk about some of those topics or ask some of those questions or be connected to some of the internal services that we have, that it doesn't require disclosure. It's just a space that you can come in and ask questions and participate in community. And there can be, a shared understanding that our priorities are just intentionally creating space for people to come together. But yeah, it's not I think it's about also dropping the expectation of doing things perfectly and just asking questions and being honest. And I think that's part of it's a huge tenet of trauma informed, right? Is just being clear, being transparent, asking questions, and pivoting when things aren't working. And even on that note, Caitlin, I would love to talk more about like how to create community spaces, for people that are engaged in all different types of sex work. I think is an important thing to talk about, right? Like there's so many different I really like the term hierarchy. Like I think, people talk about different barriers that they experience in the sex work that they're engaging in. And you have to, in order to meet those needs, you have to have very different conversations along the way. So yeah, I don't know. I don't have like a good closing statement for my ramble, but just a stream of thought.
It was great.
I think that was an awesome ramble, and your closing statement was amazing, Michelle. Thank you. Yes to everything that you said, and just to add on a little bit of like as an organization, as workers, as service providers, approaching the work that we do with humility, right? Like Michelle said, we are not the experts. The experts are the individuals that are coming to us and trusting us with what's going on in their life, right? So then being able to say, you know what, I don't have an answer to that, and being and not being embarrassed about it and not feeling like you're not a good professional for saying that. We don't have all of the answers, right? What we do have is, and I'm going to keep saying this, our community partners, other service providers who can support us along that way too, to ensure that we're supporting this individual in front of us in a good way, right? So that humility is necessary, and it's a good, it's an important piece of cultural competency. And as was already said, if something's not working, be open to changing it and adapting the way that you do things, right? Listening to what individuals are telling you that this isn't working. Okay, how can we make it work? Right. And it's okay to say, how can we make it work? Sometimes I think we feel that we have to have all of the answers. We don't have all of the answers. We're learning from each other and we're learning together and we're building safer communities and safer spaces together.
That was beautiful. I think we're nearing, the point where we can open it up for questions. But before we do, is there anything that we haven't talked about that you all feel we are amiss in not asking or raising? No?
I think maybe not that you haven't asked or something we haven't, or maybe it is clear, I don't know, but just wanted to say it like we want, and I'll speak for all of us, we want folks to know that they're not alone, right? At Sasha, we say we believe survivors, and I think we all believe survivors here. And folks, when folks are ready to receive services, to receive support, to reach out for support, as human beings, we have to be humble in our approach and be there to listen to that individual and ask them what it is they want to do, and not tell an individual what to do and how to do it, right? Offer options, right? And even the options are, we say small o, small options, and just offering them to folks and see and let them guide you in the way. That they want to go. And if someone says, I really just want to vent right now. I just want to tell you what happened, and I don't need a response, that's okay too. That's absolutely okay. So just reminding folks that they're not alone, that there are supports and services, and friends and family who are able to support you. And I think I keep saying community partners, but I'll talk about our crisis line. Like if you are a professional family member, a friend who is supporting somebody who is a survivor, and you have questions for yourself, call a support line, and ask, what can I do? What makes sense? You don't have to figure it out by yourself. There are supports and services available for you too, and crisis lines are a great first step.
Thank you so much, Jessica, for that. And I think just to add on to what all of you have said here and what Caitlin has already alluded to, that we say as service providers, we also say we've got safe spaces, but what we're looking at is having safer spaces for people to be able to come and be free and also be able to get the services that they need. And we're also looking at the knowledge part of it, that we also want people to know of the services that we offer and also to know what they could do to be healthier and be safer. I don't know if Sarah, you've got anything else to say, and I would like to open it to our attendees to just put in their questions in the question and answer, and then our panelists can speak to them.
Yeah, don't see any questions yet in the chat. I have a question that shows my ignorance. Is gender-based violence worse like we're approaching the holiday season? I'm imagining it would be worse during this season, right? Like with all the stress. Are there seasonal elements to it?
I think it's bad all the time for different reasons. If I can summarize, I think isolation, I think, especially with services being closed, like that can impact, violence and people not being able to, maybe they're not going to work. I think, yeah, there's so many different scenarios and so many different experiences of gender-based violence. I think the seasons, for people that are unhoused, survival and maybe, so in the summer it's bad because you're staying with this partner because more people are outside and you're staying with somebody that maybe is unsafe. In the winter, same thing for same reasons, different element. I think if you're housed, people are home more often. I think financial stress, like there's many reasons that people
Mhm.
are, inflicting violence on others. But yeah, I just think we know that it's an epidemic right now and it has been for a long time, but it's increasingly getting worse. I don't know if the seasons change it much.
Hmm.
If I may also say, like, there's been
Absolutely.
a significant change. So, like, when I started in the industry to now, it was like around COVID, it was like people stopped acknowledging like that same human compassion and that respect. That shifted things drastically. And like, this sounds really silly, but I always found the Friday of a long weekend. Like, I straight up stopped working the Friday of a long weekend because people were just so much more aggressive when that weekend was coming up for some reason. So, like, I like it's just I would think holidays are a part of that, but I don't know it because I know like point blank, like it was me and a few of my friends that were just like, we're not doing this anymore because they were wild.
Um, Yes to everything. And like we're thinking about right now, like the winter holidays and like what the financial and emotional stress can be on people. So like the holidays can bring on that significant emotional strain, and those tensions that exist within a household too. Also when we have like holiday times, increased family time too, can bring on that violence, but also those triggers for survivors, right? Having to come together as a family, uh, and being possibly with a person who's harmed you, because it's family and because it's your duty to be there with your family, can definitely bring on more stress, and or gender-based violence as well, and intimate partner violence for sure. And I would say in the summer months, we know that like the extreme heat can exacerbate those tensions as well too.
That that just brings us to just the fact that I think gender-based violence is just there every other time, yeah. And it's on us maybe to educate people and to be able to create those safer spaces. I will just keep coming back to us creating safer spaces for women and gender diverse people. And like what Caitlin has also said, I remember that during the COVID period, there were like lots of reports of gender-based violence, mainly because most people were not going to work, the financial burden, it created tensions in the household. And I also want to believe that during the holiday, those tensions can also be high as well because of the financial burden and just being around each other more in the house can also bring those tensions as well.
I would add
Um,
too, if it's okay.
sure.
It's like you were saying during the lockdowns and even during holiday times, it's that change of routine, right? On a daily basis, if you're a parent, you take your kids to school, and you've got that time away, right? And possibly your partner goes to work, but then we're, during lockdowns, we're stuck together, and those routines are really, really changed. So when gender-based violence happens, partners are together. And perhaps that safer time for you was when you were taking your kids to school, right? And then you were able to go out and do the groceries and whatnot. And so changing that routine can definitely exacerbate things.
That's very true. I'm not sure if Sarah, you still have any more questions or we can move forward.
No, I think there's no questions in the chat, so people are being shy, or else they've learned everything and just are just sitting with it. So yeah.
So maybe this time I would ask our panelists to just maybe just give us one takeaway message for everyone who's attending. what you want us to learn, what you took away from this, any message that you want to give us and the people who are attending this session today. Whoever wants to go first can go.
I think I gave my takeaway message, just reminding everybody that you're not alone, that there are individuals, supports, and services available, and ready to listen, that you can reach out to when you feel that you're ready to reach out to. Um, it is not your fault. The violence that has been committed against you is not your fault. You are not to blame, and we're here to support you. We believe you. And I think that's safe to say for all of us around the panel right now, that we believe you and you're not alone. So just thanks to everybody for putting this panel together during these 16 days of activism. Thank you to my co-panelists. You're both amazing too. And I appreciate learning from you and sitting with you together today.
Thanks, everyone.
Caitlin, Michelle, do you have anything to say for us to take away?
HIV and gender-based violence are deeply interconnected. Many of the risk factors for HIV, coercive relationships, unequal power dynamics, survival sex, unsafe housing, substance use, it's all rooted in violence at the end of the day. I think to support people living with or at risk of HIV, we have to address GBV, stigma, and system inequalities, not just individual behaviors, right? So safe, trauma-informed, culturally relevant spaces create the pathways that we need for safer and healthier communities.
Thank you. I'll give Caitlin the space.
Yeah, I think my takeaway is just that addressing HIV and GBV requires a lot more than individual interventions, right? Like it can start with just one individual, but it has to be bigger than that. It requires you to challenge the systems that are in place, and and looking at them and kind of picking them apart a little bit and seeing how we ended up where we are. Um, and I think that that's what I would like to leave that with is just challenging the systems that have created the criminalization as well as the colonialism and racism that we see right now.
We do have a comment from someone in our audience who said they worked in healthcare during COVID. There was a drastic spike in sexual assaults at the center, maybe because people were stuck together with so many burdens. Consistent with what you all said.
Yeah, that's very true. And thank you for that, Vanessa. And I think this brings us to the end of our discussion. I'd really love to thank Jessica, Caitlin, and Michelle for being part of this discussion. Thank you so much. We've learned a lot, and I'll be reaching out to you for more collaboration. And I would like to acknowledge the hard work of my colleague, Sarah Birch, who couldn't be part of this discussion today because of an emergency in the family. But I'd really love to acknowledge the knowledge and all the hard work that she put in the preparation for this webinar. And I'd like to thank Sarah Idel, that's my manager, for stepping in and
You're my manager.
and oh yeah, for stepping in and helping me put this discussion up and bringing it to fruition. And I'd really love to thank everyone for attending and hoping we can have more discussions like this. Thank you so much. I don't know if you've got anything to say, Sarah, before we call it a wrap.
No, thank you. Oh, this is great. Appreciate it.
Thank you so much. Have enjoyed the rest of your day to everyone who's here, and thank you. I'll keep saying thank you.
Thank you so much, everybody. And like Jessica said, thank you so much for participating in this panel alongside us for this really important conversation. It was lovely to meet you all virtually and have this conversation.
Yes, thank
Oh,
you.
thank you. Enjoy the rest of your day.